breast density can be thought of really two different ways, either the biology or how we practically measure it. The biology of breast density is that you have more fibrous tissue in the breast that makes it stiffer. And the more of that type of tissue, the higher the risk of breast cancer. But when we think about it from how we measure it and detect it, it's done with mammograms. And in mammograms, breast density shows up as the white part of the image. The breast cancers also shows up as white in the image. So breast density, the more breast density you have, the harder it is for a radiologist to see the cancer in your mammogram. So why do some women have higher density than others? It's linked to several factors. Some you can do something about and some you cannot. Factors you can't do anything about are who your parents are. Native Hawaiian women, Asian women generally have higher breast density than Caucasian women and Hispanic women. But there's lifestyle differences that can lead to higher density or lower density. For example, body mass index, the amount of body weight you carry around, impacts your breast density. Women that smoke generally have higher breast density. And having children lowers your breast density. So there's many factors, including diet as well. So this new law, which is a modification to the Mammography Quality Standards Act that's been in effect for about 20 years, is a language that has to be put into the report that goes to the woman. The report used to say, Mrs. Jones, we don't see cancer, come back next year. Now the report must say, Mrs. Jones, we don't see cancer, and I'm not going to quote the exact wording, but it says, however, you have dense breast, it's harder to see cancers in dense breast, and you should be aware of this. And that's the paraphrase of it. If you don't have it, there's similar wording if you don't have dense breast. One practical thing you can do once you learn about your breast density is there are risk tools that you can go to online, and you can plug in your age, your breast density, and other risk factors and determine what your overall breast cancer risk is. Not all women with high breast density have high overall breast cancer risk. And it should be part of your normal routine, calculating your breast cancer risk, having your regular mammograms, doing self-examinations, just to make sure that your breast's healthy. The important thing that you need to know about it is just talk to your doctor at your next appointment and say, in my report it said that I had high breast density. Let's talk about it. And is there anything that we should do? And that's the best, it prompts the conversation to have with your doctor. So the difference in breast density by ethnic group is important, especially for Hawaii, because Native Hawaiian women and Asian women on general have higher breast density than Caucasian women. So that means that the women of Hawaii can have more cancers masked in their mammograms and may benefit by supplemental screening like MRI or ultrasound. But it also could mean that their risk profile is higher when compared to those not in Hawaii. Well, some of the new technologies that are being used clinically are things like digital breast tomosynthesis, or what many patients call 3D mammography. Hawaii is using that extensively at our centers because it allows you to look through the breast and remove the density from the picture. by looking at slices between the density. So that's one development that's happened probably in the last 10 years, where that's a tool to use for women that have higher density breast. Allows us to look through the density. The second is to, if the risk is high enough, to alternate between MRI breast imaging and mammography. Maybe 1 year mammography, the next year MRI. The impact of my lab, it's kind of a funny story how I got involved in breast density, because when I started as a young professor, my colleagues knew that I was an expert at measuring bone density. And they thought, since you can measure bone density, maybe you can measure breast density. So I developed some methods that were used in the early days on how to measure breast density for large studies. In fact, the method that I developed was one of the first methods that show that the volume of the dense tissue that you have in your breast is a more powerful predictor of breast cancer than just how it looks on a mammogram, the area of the density in the mammogram. Another thing I developed was using methods like we used for bone density. We have a very low dose, non-mammographic method to measure breast density in young women and girls. And our study in girls dates back to 2005 here in Hawaii, where we looked at the development of breast density through the puberty development stages. And we've used that to get a better understanding of the risk factors for developing high breast density in young girls. My lab also hosts a workshop called the International Breast Density Workshop since 2002. It brings together all the experts in the world on this topic to discuss about the biological basis of breast density and any large clinical trials that have been done in the last 2 years, and new methods of measuring breast density. One of the biggest impacts that's happened over the last 5 years is the use of artificial intelligence to understand the risk of breast cancer beyond just a single number like breast density, but the texture of the density and what the overall image looks like using artificial intelligence that just wasn't possible 5 years ago.